So of course in our last clip we discussed how the average physician would go about performing an amputation, which is honestly part and parcel of what most people typically think of when it comes to a hospital from the 18th or 19th century or even beyond that. But for those of you who missed out on the last clip, then we're going to talk, or just kind of summarize, the brief practice of trephination, which was used to treat those who had suffered cranial trauma and possibly had a buildup of fluids on the brain. So what the physician would do is he would go ahead, sit you down, he would give you whatever kind of roots or herbs necessary to make sure that you were good and comfortable, and then he would shave the area where he had to operate. From there he would take his knife, cut the scalp, peel the flesh back on either side, and then he would take his trephination tool, which is kind of like an auger or a turn screw, which would then cut open or bore open a hole in the skull. Now, interestingly enough, although one would think this causes a lot of pain for the patient, especially if he's awake, interestingly enough, although the human body is covered in millions of nerves everywhere, the skull is not one of them. So once you got past the scalp, the patient, although he could feel the sensations, he didn't actually feel any pain. And then when the hole was drilled, he didn't even feel anything then, except maybe for the rush of fresh air going into the hole, and he would feel it on his brain. So it was kind of an interesting thing, and we see this is used in medical practices even still to this day, obviously on a much more secure scale. But then they would go ahead, they would tilt his head over and allow the fluid to drain off. Now, with the American physicians, what they would simply do is, after this was done, they would pack in a Linton mixture, sew the scalp back together, and that was it. The hair would grow back and the skull would grow back, or at least that was what was to be hoped. But the Spanish physicians, they just couldn't leave the hole alone. They decided that they had to take it one step further, and they did so rather creatively, I have to add, because they would go ahead and take a Spanish silver dollar for two reasons. One, silver was the main export of the Spanish people, so it was cheap, it was plentiful. And also, something they didn't know about at the time, silver was antimicrobial. But on evidence-based care, they realized that there was no infection any time they used silver for a procedure. So before the silver dollar was put into the hole in the skull, they would drill these little holes around the side, and then they would kind of tap it in there and friction fit it, and then sew the scalp back together. Of course, your hair is going to grow back, but so is the skull. Same to the American procedure, but here's where it really gets interesting. Because of those holes that they had drilled into the silver dollar, the skull is now going to interweave and grow through those holes in the Spanish silver dollar to ensure a much tighter fit. It's like grafting, if you will. And this ensured a wonderful tight fit, ensured that there was no buildup of bacteria, and that the patient was going to recover swimmingly well. But of course, not all these patients who went into the hospitals had to have such traumatic procedures done to them. And in fact, we see that there were some procedures done on people that would be what we call today outgoing patient care. But of course, we're going to have to talk about outgoing patients, procedures, medicines, and what patient care was like in the hospitals of the time in next week's video. But folks, this concludes our episode for Friday, and we want to thank you so much for following along on Facebook and YouTube. It's a wonderful means of support, but as always, the best means of support is by coming out to the Crockett Tavern Museum to pay us a visit. And as always, our hours of operation and admissions will be listed in the description attached to the video. Until next week, this is Isaac White from the Crockett Tavern Museum, signing off for now, saying goodbye and God bless.